They were used by Egyptian physicians. They were prescribed in ancient Rome. They nearly wiped out their own species because doctors used so many of them in the 1800s. And right now, in hospitals around the world, surgeons are using them again for real operations. We're talking about leeches, blood-sucking worms that have been part of medicine for over 3,000 years. And somehow, they're not gone. They're not a myth. They're not old, disproven medicine. They're FDA-cleared medical devices today. So how did doctors go from let's put worms on a wound to actually being right? Let's go back to the beginning, where it started. Leech therapy, technically called Hirudotherapy, shows up in medical writing as far back as ancient Egypt around 1500 BCE. Egyptian physicians used leeches to draw blood, believing that illness came from an imbalance inside the body. That idea got picked up and supercharged by the Greeks. This is where the theory of the four humors comes in: blood, phlegm, black bile, yellow bile. Hippocrates and later Galen believed that disease happened when these four fluids fell out of balance, and that the fastest way to fix the imbalance was to remove the fluid that was excess, usually blood. Leeches were the perfect tool for this. Unlike a knife, they were controllable, they didn't require much skill, and they could target a very specific area of the body. A physician could place a leech exactly where a patient reported pain, and the leech would do the rest. By the time we get to the Roman Empire, bloodletting, with leeches or with blades, was mainstream medicine. It wasn't a fringe practice, it was a standard of care for centuries, prescribed for headaches, fevers, bad moods, skin conditions, and pretty much anything else a doctor couldn't otherwise explain. The golden age of the leech. If ancient Egypt and Rome started it, the 18th and 19th centuries turned it into an obsession. In Europe, leech therapy exploded into what historians now literally call leech mania. Doctors were prescribing leeches for almost every ailment imaginable, from tuberculosis to obesity to mental illness. Some physicians would apply dozens of leeches to a single patient in one sitting. The demand got so extreme that leech populations in parts of Europe were hunted to near extinction. France alone was importing tens of millions of leeches a year at the peak of the craze. There were leech farms, there were leech traders, there was a whole industry built around one small, blood-drinking animal. And here's the interesting part. This wasn't quackery on the fringes. This was taught in medical schools. Respected doctors wrote entire textbooks on the correct way to apply leeches, how many to use, and where on the body to place them for specific illnesses. Of course, we now know the four humors theory was wrong. Bleeding a sick patient often made them weaker, not better, and some historians believe it may have contributed to the deaths of prominent figures who were bled while already critically ill. So by the late 1800s, as germ theory and modern medicine took over, leech therapy fell out of favor almost completely. It looked like the leech's medical career was over. The comeback. Here's the twist. Leeches didn't disappear from medicine. They came back, but for a completely different reason than ancient doctors ever imagined. It turns out leech saliva contains a powerful mix of natural compounds. Hirudin, a potent anticoagulant that stops blood from clotting, a natural local anesthetic, which is why a leech bite often isn't felt. Vasodilators, which widen blood vessels and keep blood flowing to the area. Modern medicine figured out that this combination is incredibly useful in one very specific situation: after reconstructive and reattachment surgery. When a surgeon reattaches a severed finger, ear, or does complex skin graft surgery, arteries are relatively easy to reconnect, but tiny veins are much harder. If blood can't drain properly out of the reattached tissue, it pools, clots, and the tissue starts to die, even though blood is still flowing in. This is exactly where leeches shine. Applying a leech to the site draws blood out of the congested tissue, keeps blood flowing through it while the tiny veins heal and reconnect on their own, and buys the tissue enough time to survive. In 2004, the FDA formally cleared medicinal leeches as a medical device in the United States, making leech therapy one of the few ancient treatments to be officially validated by modern regulators, not on the old theory of balancing humors, but on real, measurable biology. How it's actually used today. So what does this look like in an actual hospital in 2026? Medicinal leeches used in clinical settings are specific species, Hirudo medicinalis, bred in sterile, controlled facilities, not pulled out of a pond. Each leech is used on exactly one patient, one time, then destroyed, to prevent any risk of infection between patients. A trained nurse or surgeon places the leech directly onto the congested tissue. The leech attaches, feeds for roughly 20 to 45 minutes, and drops off once it's full. During that time, its saliva keeps the local area anesthetized and the blood thin, which is exactly the effect the surgical team wants. This technique is most commonly used in microsurgery and reattachment procedures, fingers, ears, scalp, lips, reconstructive flap surgery, where a section of skin or tissue has been moved from one part of the body to another. Certain cases of severe bruising or blood pooling after surgery. It's not a cure-all. It's not used for infections or fevers or the huge list of conditions ancient doctors once treated with it. It's used for one very narrow, very well understood problem: venous congestion after reconstructive surgery, where nothing else does the job quite as well or as cheaply. There's also ongoing research into Hirudotherapy-based drugs, where scientists try to isolate and synthesize the anticoagulant compound from leech saliva without needing an actual leech, which could eventually replace some blood-thinning medications. What this tells us about ancient medicine. This is what makes leech therapy such a fascinating case study in medical history. Ancient and pre-modern doctors got the theory completely wrong. There's no such thing as four humors that need balancing. Bloodletting as a general cure was, in most cases, actively harmful, but by trial and error, across thousands of years of use, they landed on a tool that turned out to have real, measurable value, just not for the reason they thought. This pattern shows up again and again in the history of medicine. Willow bark really did relieve pain long before anyone knew about aspirin or how it worked at a chemical level. Moldy bread really did treat some infections, long before penicillin was discovered. The ancient world was doing careful observation without the tools to explain why something worked. Leeches are maybe the clearest example of this. Wrong theory, real result. And it took modern biochemistry more than 2,000 years to explain why the ancient tool actually worked. So next time someone tells you that ancient medicine was just superstition, remember, there's a jar of medically approved leeches sitting in hospitals right now, doing a job that modern surgery still hasn't fully replaced. If you found this as fascinating as I did, hit subscribe. I'm covering one strange piece of ancient medical history every week, and next up is mummy medicine. Drop a comment. Would you let a doctor put a leech on you if it meant saving a reattached finger? I want to know. See you in the next one.